guys, just want to come and talk to you today real quickly about what is dose regimen design. Well, dose regimen design is pretty easy to figure out because it only contains two components, so we'll go over both of those. The first thing we want to talk about is, what is our dose rate? Well, dose rate is just simply dose over tau, or dose over time. So the way that we look at things like that is we want to find out how often a patient is getting a drug. It doesn't really matter what you want to put the rate in as long as it's something that you can compare with. Now say if I have two patients and my first patient is getting 500 milligrams a day. My second patient is getting 1,000 milligrams a day. It's pretty easy to compare that patient A is getting less drug than patient B. However, if all I told you was that patient 1 was getting 500 milligrams, patient 2 was getting 1,000 milligrams, you wouldn't really know what to compare. Because what if patient 1 was getting it twice a day, and then patient B was just getting it once a day? That would mean they were getting the same thing. That's why we always want to put things in the form of a rate, per day, or per minute, or per hour. That way we can compare two different dose rates. Now the second thing we want to talk about is our dose interval. How often is a patient getting the medication? So our dose interval is tau. And this is where you'll see doctors say, I want something given every 6 hours, every 12 hours. Sometimes they'll say things like, I just want it QD. Even though that's not really a technical term anymore. You're not supposed to use QD. It should be Q daily. But as we know, they still sometimes do it. And then, of course, we see TID, which is 3 times a day. So that's really the two components that you need to know is dose rate, how much are they getting over time, and how often should they be getting this. So we'll go ahead and erase this handwriting real quick. There we go. Move on to the next. So how do we use this? If a doctor comes in and says, pharmacist, I need your help. I want my patient to get 1 gram a day. And that's what I want them to get total. But I don't want to give it to them all at once. I want to give it to them every 6 hours. How much medication should they get every 6 hours? That way I can make sure that they're getting 1 gram a day. And you're like, that's not a problem. I'll figure out the regimen. So all we do is take 1 gram a day. And we know a patient is getting it every 6 hours. So that means they're really getting something 4 times a day, right? Right. So that just means we take 1 gram divided by 4. And that equals our 250 milligrams every 6 hours. So then we just have to call up and tell the doc, you know what, I got a perfect situation here. We'll just give them 250 milligrams every 6 hours, and that'll get you exactly what you want as a total of 1 gram a day. Pretty cool, right? Not too hard either. That's what makes it so perfect. And of course, there's our answer. Let me erase that up there too. Now if we look at the next one, the doc says, you know what, that was a great idea, but I just realized my patient can't take something 4 times a day. I want to switch it so they're only taking things 2 times a day or every 12 hours. Now what do I do? Well, that's not a problem. We're doing the same thing. We're taking 1 gram a day. And this time, since they're getting it every 12 hours, they're getting it 2 times a day. We'll just divide by 2. And that gives us 500 milligrams every 12 hours. Pretty nifty, right? Look at that. We're right again. And the cool thing you can look at is the patient is getting the same dose rate. The dose rate hasn't changed. They're still getting 1 gram a day. It's just their dose regimen has changed to work out with the situation based on our tau. So in this situation over here, both of these will have the same CSS average, just their dose regimen is different, and that'll affect their peak to trough, which you guys will learn more about here in a little bit. So our next problem is just 2 grams a day given every 6 hours. So if the doc comes in and asks you, what dose regimen would you give? What are you going to do? I'll give you a minute to think about it. Alright, I know you guys have figured it out. Again, same simple math, right? That's the great thing about it. It's just simple math. But it makes us look like geniuses when the doctors talk to us. And they want to give it every 6 hours, so we know that that's 4 times a day. So 2 grams divided by 4 is 500 milligrams every 6 hours. Sorry about that. 6, not so pretty, huh? But there we go. Right there's the answer, and we look impressive to the doctor. All right, we got one more for you, and we'll let you go. All right, this last one, pretty simple again. We get 2 grams a day every 12 hours. I know you guys have gotten the handle of this again. So pretty simple. Take 2 grams a day, divide by 2, because if we're giving something every 12 hours, it's only 2 times a day. And that gives us 1 gram every 12 hours. Pretty cool, right, guys? Thank you so much for listening, guys. I really appreciate it.